Hello viewers, and welcome to yet another special edition of a program called Talk to the Camera with me, Syl Akempta-Kargbo. As we don't bring to you anytime where the mobile health clinic they left for going to the provinces, we don't show you how the process can tell, we don't count different interviews then to you. Today again we did at the U building compound for make sure say we show you as they left for go Kailahun and Kono. You go listen waiting the medical superintendent when a Dr. Kargbo get for say, and also waiting Dr. Mustafa Sondufu Kaba waiting self for tell we as the plans ahead, waiting at the challenges the way that they face, and also waiting that they expect from the government for make this program continue for the, as we all know say, Salon now we all and the Ministry of Health and Sanitation they try for the people who will not get the upper hand for get proper medical facility, the benefits from the bosses there. So stay with me as we go get an interview with them now.
Mark, can you introduce yourself to viewers?
Yeah, Dr. Kargbo, the medical superintendent of this mobile health clinics.
Why are we here this morning?
Yeah, you're here as usual to just support us as we embark on this journey for another outreach service to the provinces.
Where are you going this time? Yeah?
This time we're very excited. We'll be going to Kono and Kailahun.
What exactly will you be doing?
Yeah, so it's a primary care outreach program when we're going to be doing just what we usually do, which is we screen people for various diseases including high blood pressure, diabetes, and then people that are sick can also come in and we see everybody for any condition. The only thing that we don't do is surgery, but even those patients requiring surgery, we stabilize them and then we coordinate their referral accordingly. But we see every patient with any condition. We see even a child that's born today.
You've made several trips to the provinces. What have been the challenges as you embark on this one?
Yeah, obviously the challenges is the fact that I feel as though the supply has not yet met the demand for the services. So as we go, we realize that the services is gravely needed by our people. They really need the service, and I wish that we will be able to have more funding, and then so that we'll be able to meet the demand of the services. But another challenge again that I find is the fact that some of these places that we visited, the roads are not good enough for the buses to be able to go to. So we still have some areas that we cannot reach, and for those ones we're really trying to use like land cruisers and see ways that they can bring this patient to us, or then some of us, the doctors, can actually go through the use of just using land cruisers or use bikes, and that's what I hope we'll be able, that's how I hope we'll be able to address that challenge.
You're heading for Kailahun. How many patients are targeted to treat?
So in general, we see like a minimum of 300 patients a day for each bus. So for the 4 buses, say for instance in Kailahun, 2 buses will be going to Kailahun, and so for those ones they're expected to see about 600 patients. So among the 4 buses in total, they will see around 1,200 to 1,500 patients. Yeah.
What have been your successes so far since you started this journey?
Yeah, the successes are immense. Among them is the fact that people are actually making use of the services, and it's actually real. Like for instance, one of the DSO in Port Loko, we actually diagnosed them because we also do ECG. Came in with chest pain and we diagnosed him with heart disease. Obviously, Imana has discussed this, so it was okay for me to disclose this information. But yeah, so we refer him to Dr. Russell, and with that emergent identification and management, he's now doing okay. So that's just very little of the many stories. We are saving little babies. We have pregnant women coming to use our services, and seeing the outcome of their illnesses being like them being well, that's just very remarkable, and it's very fulfilling.
What have been the most common disease reported so far since you started this journey?
Yeah, so the common diseases really varies by the age group. So let's say in general for adults, including older adults, it will be hypertension. And then in kids, basically, it will be fever-associated conditions. So mostly it's malaria and pneumonia. And for pregnant women, it also depends on where we go. So they will have hypertension, they have diabetes, but then also they have infection. So these are like the common things, really depending on the age category. But primarily hypertension remains a major problem.
Doctor, at a time like this when you are currently mourning your mom, I made to understand today is the 40th day since she passed off. How does it feel living, Freetown, going to the provinces just to serve the nation?
Wow. Okay, so
I'm sorry about this, but I just find I needed to ask.
Thank you so much. And because our job, most of the time we just forget about ourselves, and then the focus becomes all about the people. So I'm very passionate about my job. Personally, I grew up here. I was raised in Canada, where I've been for 24 years. I came back to Sierra Leone to care for my mom, who had suffered from stroke, and unfortunately she passed away 40 days ago. But it's the best thing I ever did. I'm very grateful that I had the opportunity to actually get to be here and help my people. For me, I think it's very fulfilling. I know that my choices are I stay home and mourn, or I go out there and help the people. And I've chosen to go out there and help the people because I know that seeing the smiles on their faces after they use our service just makes everything worthwhile. I'm grateful.
So what's next after this trip?
What's next after this trip? We are really excited. We are planning to go to Pujehun. We have to go to Bombali, just among the very few places left for us. We're hoping that we can get to all the 16 districts. That's the plan, that's the target.
As we leave your general message to the people of Sierra Leone.
My general message to the people of Sierra Leone, my people, thank you very much. Thank you to the media for always being with us and for your support. My people and the people of Kailahun and Kono, we are coming. This is for you. Please make use of them. This is real. We're going to diagnose majority of the conditions that we see, and then we're going to manage them accordingly. We need your support. We need your trust in us and the system for us to be able to do a good job.
Thank you very much.
I'm Dr. Mustafa Kaba. I'm the Deputy Chief Medical Officer, Clinical Services.
Take us through why we're here this morning.
Well, we are here again today to bid farewell to the buses who have been going on missions to provide free healthcare services to the people of Sierra Leone. Today, this trip, the buses will be going to Kono and Kailahun district. So that's why we're here, to bid them farewell and wish them well.
This is not the first trip they are making to the provinces. What have been successes recorded so far in their previous trips?
Successes have been that we've treated a lot of patients, a lot of conditions that were there undiagnosed in our communities, which led to fatalities and deaths in our communities, have been identified at an early stage, and these patients have started receiving treatments. We've also been able to expand our COVID-19 vaccination, as well as all other vaccinations we have been giving to our people of Sierra Leone. And it has been received well in our communities. The people have been participating well. And so at least these are some of the successes they have achieved so far.
It is no secret that one of the challenges faced by the bosses is finance. As Deputy Chief Medical Officer, what are the plans to ensure that there are enough finance or support to this trip so that they do not actually have challenges when they want to go to the provinces?
Like you said earlier, I mean, this is a very finance-intensive venture, so it requires a lot of funding, and it's going to take a long time to do all of these activities, not something you do for 1 month. So the ministry, of course, has so many other priorities, but we have prioritized this one to make sure it receives the full funding it deserves so that the people of Sierra Leone benefits. And what we are looking at is the sustainability of this entire Hospitals on Wheels project. What we are doing now is the beginning, but it has to be properly incorporated within the Ministry of Health and Sanitation Services.
All right, sustaining the buses means we should be going through regular maintenance. What are the plans for that?
Well, luckily, when these buses were donated by the Chinese government, we had technicians who were trained, and they are very qualified. They are qualified to make sure that these buses are kept in good shape. Even now, before moving today, these buses have been checked. Maintenance activities have been done completely. So we ensure that regular checks are done, funds are provided, so that these buses can last with us in the ministry for so many years before we get new ones.
We just heard from the MS that it is your plan to ensure that all 16 districts in Sierra Leone benefit from this service. But you agree with me that the buses cannot reach most of the districts in the country. What are the plans to ensure that the dreams of you covering the 16 districts be achieved?
Well, we are working with the other MDAs, other ministries, so that at least the road networks will improve, so that these buses can go to those communities we have not been able to reach. But in the interim, we are also having plans of having hub and spokes model, wherein the buses can go to a location where it is tarred, and then beyond that one, we might send small ambulances, maybe small vehicles, motorbikes, to go and reach those communities, bring people on board the buses. So these are all plans we have.
Same with your message to the people of Sierra Leone.
Well, to the people of Sierra Leone, the government of Sierra Leone is a listening one. It is providing free healthcare services for our people. Please make sure you make use of the best opportunity that's been created through these buses. Come on board, mobilize your people, especially the people of Kailahun and Kono this time. Come on board and make sure you make use of this good opportunity which is coming your way. And all services on board these buses are free. You're welcome.
Viewers, hope you have done listen wetin Dr. Kargbo don tell we, as he say most of the challenges the way they face, the buses no dey able go all side because of the road network, and also they call on government for the government continue for support them financially so they go able for the embark on their journey there where everybody go benefit. And also Dr. Mustapha Sundufu Kaba don tell we say the government now listen governments that they make sure say they listen to citizen cries, and they go make sure say they continue for the maintenance them bus there until they go get new one, because the Chinese government may train expert then Salonia way themselves the maintenance them bus there, so them bus here go be in good order anytime they ready for embark on a new trip. Me na Syl Akempta-Kargbo, and continue for the stay with we as we get for the show you anytime where they go na the provinces. Stay blessed.